on Morning Cafe. I'm used to Stanley Nyeringita. And do you oftenly have, one of this kind of teeth and unagopa sana kusmile mbele ya watu? Well, today we give you, the tips on how to not worry, because we have Daktari here to help us understand what this means. It's called dental fluorosis. It's a very mouthy word. My brothers and sisters from the central region will be biting their tongues trying to pronounce it. You can always send in your questions, any kind of feedback that you have when it comes to how to solve all this. Yes, Daktari will be answering all that for you. 0795-045-864. Let me repeat that for you so that ukitafuta credit sahi, you write that number down. 0795-045-864 is the number to call it. Our numbers are open for you. 22047 is our SMS number, at TV47KE on Facebook. Daktari, PJ Mujuki, karibu sana.
Asante sana.
I'm curious, what does PJ mean?
PJ is a short form of Peter Jackson.
Peter Jackson.
Yes, my parents were that cool. Yes.
You're going to call MJ, Michael Jackson. Anyway, so what, basically, because I know we'll get to understand all this, but then, first of all, what is dental fluorosis?
Right. So dental fluorosis, like you said, is a mouthful, but it is a condition that affects the outer layers of the teeth during formation. It's usually caused by intake or ingestion of high fluoride, mostly in water. So these teeth, as you can see, they are characterized by a lot of sensitivity. They usually break off, or you find that they are breaking off on the surface, and of course they are discolored. The discoloration can range from chalky white discoloration to brown. Yes. Right.
You mentioned during formation, so at what age of a human being should that be?
Yeah, that's a good question, because the dental fluorosis, most people confuse dental fluorosis with staining of teeth. When you take food, sometimes you can get staining, or if you don't brush your teeth. But now dental fluorosis is different, because this is within the composition of the tooth. Other stains usually stay on top of the tooth surface, but this one is within the composition of the tooth. So it normally affects you from 0 to around 12 years of age. Because that's when the teeth form. And once teeth form, then they do not regenerate again. I think it's the only part of the body that does not regenerate, because if you cut your hair, it grows back. If you fracture your bone, it can easily heal. But once the teeth form, and that's why when they get cavities, you have to go to the dentist for them to get filled. Right. So it is between 0 to 12 years of age.
So at this period of 0 to 12 years of age, how frequent should the usage of the fluoride be so that one can actually get to this?
Yeah. So that's a very good question, because when you're talking about dental fluorosis, there are 3 things that we normally talk about. We talk about the timing, of which you said it's between 0 to 12 years of age. Then we talk about the duration. How long have you been exposed to this high fluoride in water?
Right.
All right. So if you find that you've been exposed for a short period of time, it will only affect the teeth that were forming during that particular time.
What's the short period of time?
The way teeth form, the way teeth form, there is a schedule in which the teeth form. They don't all of them form at once. And that's why you find that there are some teeth that usually erupt at a certain age, between 5 to 6 years. Others will come in when you are 12. So if you are exposed when the teeth that are supposed to erupt at around 6 years, then you'll find the front teeth are the ones that are affected more. So in the same person, you may find that they have different severities within the same tooth. Within the same mouth. So you might find the front teeth are more affected than the back teeth, or vice versa. So that's what we mean by the timing. Then the last thing that we normally talk about is the dosage. How much of the fluoride have you been exposed to? Because the WHO recommends water should have between 0.5 to 1 milligram per liter of fluoride. So if, for example, someone who is taking water that has 10 milligrams per liter, and another one is taking water that has 2 milligrams per liter, you'll find that the one that has more dosage of fluoride will have more severe form of the dental fluorosis.
Right. And one question that I'm pretty sure even the callers and the viewers would be asking later on, for example, because one area that we know for sure in Kenya is Nakuru. Nakuru residents are always having, grappling with this, bit. So one would ask, for example, ni kuwe naishi Nakuru for let's say 2 months. I had this dosage of the fluoride that you're saying 1.5 milligrams per liter to about 0.7 to 1.2 ppm. And then that's about 2 months. And then nikaenda mahali kwingine where there's no, this amount of fluoride in the water levels. Will that affect how, the thing is?
Yeah, it will because, but again, we go back to the basics. What age are you? So if you're between 0 and 12.
So now depending on if they're actually, on this age group.
If they are within that age group, you may find that depending again with the dosage and the duration, they will get affected. Not all the teeth, but the teeth that were forming during that particular time. Remember, we are not talking about when the teeth are in the mouth. We are talking about the teeth that are inside the gum, the bone. When the teeth are forming. It's actually called calcification. When the tooth is calcifying inside the bone and you are exposed to high fluoride in water, then that is when the fluoride, there is a reaction that usually comes and the fluoride gets deposited within the composition of the tooth. So you will find that if it's just a short duration of time, you might even find within the same, if it's a front tooth, could be the tip is the one that is affected, not the whole tooth. Or you may find that it's some of the teeth that are affected, not all the teeth. Yes.
So how do you know that this water that I'm taking has this amount of fluoride in the water levels?
All right. So the only way of knowing, of course, is 2 ways. Number one is where you do the chemical analysis of the water. There are many labs that can be able to do that analysis of the water. So it means that, for example, if you're living in an apartment somewhere, you can always fetch the water. Even the government chemist, you just fetch the water and you take it for it to be tested for the level of fluoride. Then, of course, the other one is, historical. You can look and see that, for example, the way we talk about Naivasha and Nakuru, there is study that has been done. There are some of our colleagues called public health dentists that are doing a very good job in trying to map out the whole country in terms of the fluoride level. And they already have quite a substantial amount of data, which I think can be used for informing the public.
So if I was going to be using rainwater directly without having to tap it through the iron sheets and everything, will that have any effect?
No, I think rainwater is safe. It's actually one of the ways that we encourage people to do when you use the rainwater for cooking and for drinking. Because again, most people think it's only water for drinking, the one that you're taking directly. But it is actually also the water that you use for cooking. And to some extent, if you also take food that has been grown or irrigated with water with very high fluoride, kales, arrowroots and all those things, then it also contributes to the load of fluoride that is in your system.
So on the flip side, so what if I tap this rainwater through the iron sheets and everything in ingia mahali kwa tank? Will that have any? Does maybe corrugated iron sheets have any effect on that?
Not really, because when we talk about fluoride, fluoride is actually a mineral. It is a mineral that is contained mostly in the rocks. And that is why when we are talking about dental fluorosis, we most of the time talk about borehole water. Because as you go down to fetch water on the rocks, the water that is in the aquifers usually dissolves the fluoride. And therefore, when you are fetching that water, of course, because it has interacted with rocks that have very high fluoride, and this mineral gets dissolved in this water. So when you fetch it, then you find that it might contain not only high fluoride, but other contaminants that may be found underground. So as of the rainwater coming through the corrugated sheets, again, there are many other factors that you have to look at. But as far as a general rule of thumb, rainwater is safe.
It's the best way to go. Right, so I'll have to invite you over to look at some of these photos and just, even for the viewer to understand, they're watching us this morning and they're like, hey, I want to make a photo ya my dental formula. Where did they get it? So we'll be taking a look at a couple of some of this dental formula. We'll start with this one.
Yes.
So what are we looking at right now?
So we are looking at a picture of someone's dentition. And what we can, of course, there are many things as a dentist that we can talk about, but for the sake of this discussion, we can obviously see the discoloration that is on the teeth. And as you can see, it is actually mostly affecting the front teeth. And this is what we were talking about. And it's mostly affecting the upper teeth more than the lower teeth. So again, the question of timing. When was this person exposed to this high level of fluoride? So as you can see on the upper teeth usually erupt at around 8 years.
The incisors.
So the upper incisors, these are usually the first ones. So most likely when these ones were forming.
It's incisors, not incisors.
It depends with whether it's US English or UK English. Yes.
Right.
Yeah.
Okay.
Yes.
I am hereby corrected.
Yes. Yeah, so this is a good picture because it shows us the way the three factors that I've given you interact. The issue of timing, the issue of dosage, because as you can see, this one is severely affected compared to, let's say, these ones, right? And also the issue of duration, like how long were you affected? So this is a case of severe dental fluorosis.
Severe. How do you get to actually ascertain that it's quite severe?
Usually it's the way the tooth is affected. So dental fluorosis can be from very mild to severe. So in very mild cases, you might not even know that there is dental fluorosis because we don't have discoloration. The teeth usually have some chalky white appearance, more of what you're seeing here, some chalky white appearance, but there's no brown staining. Then as you move from moderate to severe cases, that's when you start seeing now the discoloration. So you get some brownish discoloration. And now in severe cases, you find that you start getting what we call, the enamel, the outer layer of the tooth is shelling off. You find that the tooth is breaking off very easily, and the intensity of the discoloration is more.
Right.
So that one is an easy way. There is a more complicated way that we use as professionals to grade the severity of fluorosis, but as a general classification, yes, that is a good way of looking at it.
And I love the fact that you brought up the whole discoloration bit because I was going there. Some would say mine look yellow, mine look brown. What's the whole difference? Because for you, you're saying this is brownish.
Yes.
I'm seeing yellowish.
Yes.
I don't know. Again, men are colorblind.
Yes.
So
yes.
Our eyes see the kind of colors that probably we see differently. So I mean, there's that. Let's probably see another image. Let me have that. Right. Let me use the aid of this tablet to get. So there's that.
Yes.
Now this one pretty much looks brownish. Affects both the incisors all the way to also the canines.
Yes.
For both. So before we actually get into this, so the previous one only affected the upper bit and not the lower, incisors.
Yes.
Why is that?
Again, it's all the time play with the three factors. So if you find that it's only some teeth that are affected, most likely it's the duration or the timing. So if you find that this person was only affected during a particular, was probably traveled and was staying at a particular place at a particular time. So the other teeth have already formed. So we said if the teeth have already formed, like for you and me, or someone who's above 13 years, they are unlikely to get affected. So if those particular teeth had already formed, and then you get exposed to high dosage of fluoride, then you'll find that the teeth that are forming at that particular time are the ones that are going to get affected.
Right.
So if you look at this case, it's more of generalized. So this is someone probably who stayed at that particular place for a long duration of time. And again, another thing is climate change. It's another angle that our colleagues in public health, dental public health, are telling us about. Because even the concentration of fluoride in those boreholes that we are talking about varies depending with the season. So if it's during the rainy season, you find that the same borehole might have a lower concentration of fluoride. And during the drought season, you'll find that because the aquifers are drying up and all that, then you'll find that the same borehole might have even 2 times the concentration of fluoride. So again, you might find that probably during that particular time it was very rainy and still you're using that, or probably you're substituting or diluting the water with rainwater. So the teeth that were forming during that time might not be severely affected. But in such a case, you find that this is more of, you can see the enamel is breaking off the teeth. These teeth are usually very sensitive and the discoloration is generalized. So this is most likely someone who stayed in a particular place for a very long time.
Right. Yes. 2 follow-up ones. So the first one, when you say it's sensitive, does it mean, so this person is biting and chewing food, it is quite painful?
Yeah, actually sensitivity is more of, the ability to tell hot and cold. So you find that the outer layer of the tooth, it's called the enamel. It's the protective layer of the tooth. It doesn't feel pain, doesn't feel heat or anything. And that's why we are able to chew and take ice cream without a problem. But now for this particular person, you find that the outer layer is shelling off. It exposes the inner layer, or the middle layer, which is called dentine, or dentine, if you wish. And now that layer is usually very sensitive because it has pores that connect it to the nerve of the tooth. So because the tooth lacks the protective layer on top, then you find that this person, anything hot, anything cold, even chewing, it becomes a problem.
Right.
Yes.
The other one was about matters the rain, because over the past few weeks we've been having quite the rains in different parts of the region. So does this mean even for someone between 0 to 12?
Yes.
Right now, even for the parents and guardians, this is a safer time for them?
Again, it's more of a hypothesis.
Okay.
It's just basically just trying to look at some facts. It's not an absolute fact.
Okay.
So, but like we said, rainwater is safe compared to borehole water. So, and the safest bet, and another thing that we are seeing, another trend that we are seeing, like you asked me, this problem used to be in Naivasha, Nakuru, and the Rift Valley. But now we are seeing it more in the cities. Why is that? We are just able to hypothesize again and say that if you look at the Kenya National Oral Health Survey, it was done around 2015, though we have a new one here. It showed like around 40% of the school-going children had dental fluorosis, all right? And this is mostly in the urban centers, like Nairobi. This never used to happen
Nairobi
in Nairobi.
and its metropolitan
Kajiado, Narok, Kiambu, and stuff like that. It never used to happen before. The reason why we are thinking it's happening is also because of the boom in real estate. There has been a lot of real estate coming up, and unfortunately we might not have the same distribution of the water, the city council water. So more and more buildings are doing borehole. In fact, it's become a selling point. Like this house has constant water because we have a borehole. But if you look at it, it's also something that needs to be looked at because we are actually seeing more and more children having dental fluorosis because of the water that we are taking. Because most of the apartments have borehole water. And therefore it is important that even, in Nairobi, you cannot tell people to wait for rainwater. However, we have other ways of preventing dental fluorosis, including household defluoridation machines.
Yes. Right. So now this is another photo. Tell us what we are looking at.
So this is a photo of a young kid, around 7 years. As you can see, they still have some milk teeth. So the one that you see that has some silver is actually a permanent tooth. So the others are milk teeth. You can see the way the outer protective layer has been, breaking off because of the dental fluorosis. So this is a person even who has problems chewing. Most of the people think it's cavities. This is not a case of cavity. It is just a severe case of dental fluorosis. The reason why we put this is because this is called a stainless steel crown. It is to protect the permanent tooth because there's a permanent tooth that usually grows at 6 years, all right? So if that tooth also is affected, then it keeps breaking off and this person might not be able to feed. At that age, we might not be able to do definitive crowns, that is covers for the teeth.
Right.
So we usually just put something that is transitional to allow the kid to be around 17, 18 years, well, now we can do the permanent crowns. So these are called stainless steel crowns.
How often is this done, even in Kenya, in different parts of the region? And now is this, sort of like a bandit, so that if, in case in those areas, you give them this, so that now later on it doesn't really affect your teeth?
Remember, we say dental fluorosis affects you during formation.
During formation.
So this is just a stopgap measure to prevent the tooth from breaking further. So it's to protect the tooth from breaking further and to at least give the patient some function so that they're able to eat, they're able to chew, the sensitivity is reduced. So this is a clinical decision. So when you go to your dentist, they'll be able to evaluate, and this is just one of the ways that they might recommend, again, depending with the severity. So
at what age is it now removed?
If it's on a permanent, sometimes we even put on the milk tooth. If it is severely affected. So if it's with a milk tooth, then it comes out with the tooth as the tooth is ready to come out. But if it's on the permanent tooth, it can stay until you are around 18 years. Then it is removed. Then you can do now the proper tooth-colored crown. Yes. Yes.
So zingine ilikuwa tunaona watu tunaize tunadhani ni style.
Yes, there are people who think it is style, and I mean, for us it's not aesthetic, because aesthetics for us is what someone might not be able to tell that it is something done on your teeth.
Right. Yeah. Here's another whole case. I think it's quite similar to the first one.
Yeah. So again, severe dental fluorosis. You can see the outer layer of the tooth, which is supposed to be white, is totally broken off. What you're seeing is just the dentine. That is the middle layer of the tooth. Again, severe case of dental fluorosis.
The gum looks quite normal in my case. I don't know.
Yeah, the gum is normal. This is just, we call it ratio pigmentation, the blackening you are seeing there. So it is quite normal.
So normally dental fluorosis does not affect the gums?
Yes, it doesn't affect the gums. It just affects the what we call, the tooth, as it were.
Right. So Dr. even the viewer, they're quite curious. My son, my daughter has this. They're probably 12 years old.
Yeah.
So what kind of meals do they prepare for them at this age?
I would look at it differently. I would look at it as because that's the question that we usually get about. How do we prevent this? Because the most important thing is to prevent it from happening. Like I did in my introduction, I said in my introduction, this is an irreversible condition, all right? So other than just whatever we are seeing as the enamel breaking off, so and therefore affecting function, eating and all those things, it also has another very bad effect, especially for kids who are teenagers. This is the issue of self-esteem. So you find that people that have discolored teeth, they are not able to smile. I have a patient who even missed a job because of their teeth. They are very properly qualified, but that job, he was told he missed it because of his teeth. So you can imagine what that does to their mental health and all that. We have even students who are performing poorly in school or being labeled as rebels in school, like another case that I had. And it's purely because of esteem issues, because as you know, teenagers are really that's a time where they are self-aware and they are very curious about how they look. And this age of Instagram, everyone wants to flash out a smile and stuff like that. So if we can be able to prevent this, that is the starting point. And how do you prevent? Number one is you make sure that you take care of the water that you're taking. You'll find that most of these cases affect people who are able to afford even to get the machine for prevention. However, we lack knowledge. And that's why I'm very happy, Stan, that we are here talking about this, because most people, even the good book says, they perish because of lack of knowledge.
Yes.
Yeah, so first of all, dissemination of knowledge, that this is 100% preventable condition. So for those people who can, they can install what we call defluoridation machines in their houses. And I'm happy that at least now, a few years back, we were not talking about prevention. It was purely once it happens, ishafanyika. So sasa we talk about how we are going to cure it. But at least now we have, like I said, we have public health dentists who are more concerned in prevention. And there is a lot of research that has gone into this because it does not just affect the teeth. High fluoride will also have systemic effect in the body, So it can affect even pregnancy outcomes. You find that someone might have low birth weight or even premature labor because of high fluoride. There are patients who would present even with anemia because fluoride affects the absorption of vitamin B12, and therefore you can get anemia and you don't know what's happening.
Yeah.
Fluoride also gets deposited in your ligaments, your bones and stuff like that. So you have even whatever we are seeing happening on the teeth can also happen on your bone. The only difference is we are not seeing your bones. Yeah, but the same discoloration and the same weakness happens on the bones, and that's why you're finding people who are in your 20s, 30s cannot squat, they're having arthritis-like symptoms. It's all because it can be attributed to also high fluoride. So prevention for me is the key. But then again, for those who are affected, it doesn't mean it's the end of it. So there are many ways of dealing with it. Again, depending with the age of the patient.
And even as you get into the many ways of it,
yes.
So are there chances that you might have high fluoride in your body, but then you don't have, the discoloration of the teeth?
Yes, if you are an adult.
Yes. Or goes back to,
yes.
But then now still in 0 to 12 years.
Yeah.
Is it possible that the dental fluorosis does not happen, but then you still have high fluoride in your body?
Unlikely, because you see, once you ingest the fluoride, then it gets to your bloodstream, and for teeth to form, there is exchange of ions from your blood. So if it has high fluoride, definitely it's going to affect the formation of that tooth.
All right, so highly unlikely.
Yes.
So here's another bit, but then now for this one, because this is a whole conversation that hata ukipita mahali kwa barabara, in most of these areas that we're talking about, there's always that one poster that you'll see. It's called whitening your teeth.
Yes.
For these charges, call this number.
Yeah.
Is that, can we call that a scam, or that can actually work?
So again, like with any other profession, I said I'm a dental surgeon, and in any other profession, I believe even in media, kuna watu imbo. So there are people who are quacks.
Yeah.
So they definitely have seen a gap, because if you look at the number of dentists in the country and the distribution, it's a very skewed distribution, and even the dental services in the country, they are a bit skewed in terms of the distribution. So these are people who have seen a problem, an opportunity. And they usually now come and tell you we whiten teeth. And, the poster is next to Daktari wa Zanzibar,
because they always have very colorful photos that they give you the before and after.
But we have Photoshop nowadays,
Yeah, true.
Yeah, so, and again, what they normally do, like we say, this problem affects the tooth through and through. So the reason why the outer layer is usually more discolored than the inner layer is because it's also exposed to other contaminants in the mouth. So it is exposed to food that you are taking, the sodas, so all that. And because the tooth is rough, because it has broken down, then the dirt easily attaches and it's not easy to brush. So the outer layer becomes more discolored than the inner layer. So now all those quacks do is they go and use some acid and scrub off even more the protective layer of the tooth. So what will result is that you will get slightly whiter tooth, but the sensitivity, becomes just too much, because the little layer of enamel, the protective layer that was remaining, is now being scrubbed off. So you'll be happy for a day or two, but you cannot even smile because it's so sensitive. And again, after a few months, it goes back to how it was. So the best way of looking at it is you just go to a qualified dentist, and you should be able to do your due diligence. And at this point, I think it is important I say that I'm the director of dental services in Nairobi County, and we have our facilities, Mama Lucy, Mbagathi, and the rest of them, that can be able to sort that issue rather than going to some quacks.
Speaking of sorting it out, caller for you, Billy Tara from Nairobi. Habari asubuhi.
Salama sana.
Unatupigia ukiwa Ngara. Watu Ngara mnasemaje?
Sio Ngara, ni Nairobi.
Oh, Nairobi. Nairobi wapi?
Thika.
Oh, okay. Uko na swali ama maoni ya daktari hapa?
Nina swali.
Okay, uliza.
Salama sana.
Yes, uliza swali.
Ni Thika. Yes.
Naomba upunguze volume ya TV, weka mute tafadhali, alafu ongea na sisi.
Aya, nilitaka kujua. My son turned 5 last year. And has an issue on the front, or the first image that we learned about.
Okay.
So I've been wondering if now when the milk teeth dies down, like when it will be removed, will it again grow now without the fluorosis or whatever the doctor is teaching us about?
Right.
I just need to know whether it will be replaced. And so now they'll be permanent. The issue will still continue.
Right.
That image. That is the case for my son.
Okay.
Actually, on the first 4 teeth, the upper side, the down one is not affected.
Okay. So Dr. has heard your question, I believe? Yes. He'll be answering to you right now.
Right. Thank you. Thank you, Sarah. Dental fluorosis can affect also milk teeth and permanent teeth because teeth formation start in the first trimester. All right? Okay. First trimester. So if a pregnant woman takes water that has high fluoride, it is able to cross over to the baby.
Interesting.
And affect the teeth. So in such a case, the teeth that usually form when you're in your mother's womb, remember, we are talking about formation inside the bone, the way your fingers form. So it's the milk teeth. The permanent teeth usually start forming, most of them, once the baby is born. That's when they start forming inside the bone. So if this pregnant lady takes water that has high fluoride, the baby's milk teeth will come out, affected by dental fluorosis. And these are teeth that are usually very, you find they are flaking off. They might not necessarily be discolored to brown discoloration, because remember, this is a young baby who's just breastfeeding, nothing more, no food and stuff like that. So the teeth might not have the intense discoloration, but they'll be very weak and they look chalky white and they're easily breaking off. So if the baby is born and now they are not affected, they are not exposed to high fluoride, there's a chance that the permanent teeth will not get affected. But if they are still consuming the same water that has very high fluoride, then it's going to affect also the permanent teeth that are oncoming.
All right.
Yes.
She mentioned that the son is above 5 years old.
Yes.
If I'm not wrong. She's probably, maybe seeking. Is there hope? How will that maybe be corrected? Yeah.
So of course there is hope. Number one, by now that she has the knowledge, making sure that she's very conscious about the water that she's taking. And number two, now we can only wait and see how the permanent teeth come out. If they come out affected, again, not all discoloration requires treatment. If it is very mild or mild, then we might not do anything. But it is, if it is severe, that's now when we can do something. Again, there is treatment for every age group. Like we said, for such you cannot put a crown. If it's a baby who's 5 years, you can only probably do masking or microabrasion. There are a few things that you can be able to do. Then, and they are transitional. You are just trying to cover up the discoloration. You are not curing it. So you're just preventing people from seeing and making the teeth more comfortable. But now when you turn around 18, then we can do veneers or crowns that are more permanent. All right, yes.
Right. And just a reminder also, you can always call live. Dr. will be answering your questions, 0795-045-864, 0795-045-864. So before Sarah, right, I'm being told we do have Daniel from Narok. Daniel, habari asubuhi?
Mzuri sana. Niko hapa Narok nauliza swali. kuhusu hii mambo ya canal routing ambayo imekuwa ni kama utapeli, kwa sababu unakuta ya kwamba mtu anafanyiwa canal routing, alafu hiyo canal routing inakaa wiki moja inatoka. Yaani unashangaa sasa, hii kitu nilifanyiwa canal routing, nimelipishwa 4,000, 6,000, 8,000. All of a sudden umeenda kukula mahindi, ile mahindi ya kuchoma ile barabarani imetoka. Na zingine hata ni ugali tu imetoka. Sasa hebu daktari atusaidie, tuambie canal routing ni njia mwafaka mzuri wa kujisaidia, ama ni plagiwe tu, itolewe kabisa, ukae tu bila, kwa sababu itakuwa more safe.
Haya, sawa, asante sana. Kama tutakuja kuonja hizo mahindi za Narok pia sisi tuone. Asante sana for calling. Maybe an answer to him.
Yeah, so I believe what he meant is root canal, not canal routing. So it's a different topic altogether, but it's basically one of the ways of treating teeth that are painful. Again, if well done, it is actually the recommended way of dealing with it. But again, like I said, we have a problem because in the whole country we are about 1,000 dental surgeons serving a population of over 50 million people. So
which is very worrying, by the way.
So we have quite a huge gap, and so you find that there are more quacks than us professionals. So if someone really has to go to a private hospital, they have to do a lot of due diligence. Otherwise, they just use the government's facilities. If it is properly done by a proper profession, there shouldn't be any problem.
And now, before Sarah called, now you're telling us about you and the kind of health that you have. But mostly, so I'm curious, because you're saying for the whole whitening of the teeth, of such a teeth, one would probably, akienda kuwa quack, itakuwa whitened for, let's say, a week or two, and later on, as much as there will be a lot of sensitivity, then later on, it will recur to this.
Yes.
But then now, if this person was to go and see a professional,
yes,
what will happen?
So the professional, of course, will evaluate and see the extent of the fluorosis.
So hypothetically, this is, let's say, an 18-year-old.
Yes, an 18-year-old who has this kind of dental fluorosis.
Yeah.
The best option would be to put crowns. So crowns are covers that are usually put on top of the tooth, and it covers the whole surface of the tooth. So what it does...
Okay. Hold on kidogo, tuchukue another call.
Yes.
Nataka tuende all the way to Rongai. And Rongai is one of those places that has a huge fluoride in the water levels. Habari asubuhi, Karo.
Nzuri sana.
Watu wa Rongai mko salama hii asubuhi?
Rongai salama kabisa, tunashukuru.
Asante sana for calling us this morning. Uko na swali kwa daktari ama ni comment?
Mimi niko na swali.
Uliza.
Okay, I have 2 boys. One 10 years old.
All right.
And the other one is 10 years old, and the other one is 8 years old.
Okay.
Na sasa unaona first meno ya kwanza ilitoka. Ni swali kwa daktari, nimesema meno ya kwanza ilitoka. Hiyo yenye imemea bado hizi za mbele zote zimeharibika, both kids.
All right.
Alafu unapata sasa matibabu ni expensive. Sasa kama kuna mahali mtu anaweza saidika.
All right. So wacha tuache daktari akujibu ukiwa umeshikilia tu hapo. In case utakuwa na nyingine umuulize tu immediately. Daktari, I don't know if you've had a question, you can answer immediately.
Yeah, so I've had Karo from Rongai. I'm not sure whether it's Rongai in Nakuru or the one in Nairobi. But both places have very high fluoride content in water. And just as a disclaimer, even as I answer her, salty water is not equals high fluoride. You might have salty water that still has low fluoride, because fluoride does not have a taste, smell, or you cannot be able to see it. So regarding the kids, of course, she said that they are different ages. And if you look at the one that is, she's saying the teeth are coming out and the others that are growing are still affected. Most likely it's because of what we said, the duration of exposure is long. So both the milk teeth and the permanent teeth were affected. if you look at the age difference between the kids, again, it all depends on, again, the dosage. How much dosage was each kid exposed? So you might find even children within the same family are not exposed the same way.
The same, okay.
Yes, so you might even find others went to a school where they're using borehole water, and all those sorts of factors will affect the severity. So you might find one kid is not affected, the other one, all the teeth are severely affected, or the others are mildly affected. So for her, what I'd advise her is she goes to a dentist in one of the hospitals which are near her, ensures that she gets a properly qualified person. There's definitely hope for it. But going forward, because we said fluoride can also affect your bones and other things, including it's a neurotoxin.
Yeah.
It even affects, there's research. Again, we are scientists, so we work with data. There's research that shows even it has some neurotoxicity, meaning it affects the brain and the nervous system.
Nervous system, right.
You might even find there's a research that has shown that even the IQ of the children is affected. So there are many other effects. So even now, even if the children are above 12, then it is important that she still installs a defluoridation machine to her household, which will make sure that she's now safe, taking safe drinking and cooking water.
Right.
Yes.
I'll follow up on what you had said earlier about matters, what you ingest, what you eat.
Yes.
Even as well as the young baby, even breastfeeding and all that time, because I'm pretty sure this is what the viewers might really be asking. One, even for, let's say, the food. For example, in area where there is no fluoride, high levels of fluoride in the water, but then you always order food from somewhere, foodstuffs from somewhere where there is, let's say, from Rongai. How possible will that be? How actually will you know? Because you're advising us to measure the water levels, but then now this is food and foodstuffs. So how do you for the food?
Yeah, it's a tall order. Basically, you cannot be able to monitor everything that you are taking and where it was grown and stuff like that. Because even when you take something from the supermarket, you don't know where it came from. Yeah. And that's why for us as a dentist, our main concern is the water that you're ingesting directly. Right? The water for drinking and cooking. Right. So if you control that, then the others, the amount is not as much.
Right. Let's go to Kariobangi now, where Lillian is. Lillian, habari asubuhi?
Nzuri.
Asante sana for calling us this morning. Uko na swali for daktari?
Niko na swali.
Yes, tafadhali muuliza.
Mimi nili after post CS dawa nilipewa. Kuna dawa nilipewa ya kuongeza damu. So ili affect meno yangu ikakuwa very sensitive.
All right.
So nilikuwa natumia tu Sensodyne but haitulii. Baadaye ikakuja ikadiscolor. So after that ikaanza kudondoka. Sasa inadondoka. Kuna yenye nilitoa but zingine bado ziko, yani zinadondoka, inajikula inside.
Okay.
So nitafanya aje?
Sawa. Wacha daktari atakupea jibu ya hiyo saa hii tu.
Sawa.
Kabla ukate, maybe miaka ni ngapi ndio pia daktari aweze kupata mwenye atakusaidia?
29 years.
29, okay. Sawa. Asante sana Lillian, salimia watu wa Kariobangi.
Asante.
I think it matters dental fluorosis hapa na pale kidogo. Before we continue.
Yeah, so for her, most likely it's different from dental fluorosis because you see it's affected her after giving birth and some medication and stuff like that. So Stanley, I want us to probably even get another session to talk about even some of the things that happen during pregnancy.
Oh, yes.
Because most likely that is what is affecting our viewer. There are some hormonal changes and habits that usually come during pregnancy. And you hear people saying, oh, I lost this tooth when I was pregnant, when I was giving birth to this. So there's a lot of myths around that. And I think we need to demystify.
Oh, yes.
Because most likely from what I'm seeing, she might have had just dental caries or cavities in the teeth. That is why they keep breaking off.
Right.
Yes,
Right.
Which is associated with diet, hormonal changes, and other factors.
So not because you've also mentioned about the whole pregnancy, because that was also my follow-up.
Yes.
The whole food stuff which you've mentioned, and now for the pregnancy. So So this is, a young mother breastfeeding the child.
Yes.
She's in, one of these areas that we're talking about, Nakuru, Naivasha, areas of Nairobi metropolitan, Kitengela, Baringo, Athi River, all those areas. Is there any effect during the breastfeeding process? Even the the milk itself, can it affect?
Yes, there is a research that was done, and there are some traces of fluoride in breast milk. So again, if the mother is continuously getting exposed to high amounts of fluoride, so it the same way even when they are pregnant, it can pass through the umbilical cord to the baby. Even this one can really affect the baby also. Yes.
Interesting.
Yes.
Now to one myth that many people always say that itasaidia. Ukiwa, all the areas that we're mentioning, where boiled water itakuwa sawa sawa. Can that help?
Unfortunately, no. In terms of fluoride, it cannot, because like we said, fluoride is a mineral.
Yeah. So
it's contained inside the water. So, and again, I repeat, salty water does not mean high fluoride. You might have salty water that has, and fresh water that has very high fluoride. So if you boil water, you can imagine, for example, if you boil salty water, because fluoride can also be classified as a salt. You can say it's a salt. So if you boil salty water, that experiment we used to do in primary school, and then the question would be, would the salt be more concentrated or less concentrated? Definitely it would be more because some vapor, escaped through the steam. So the same thing, if you boil water, yes, it will be safe for drinking in terms of killing the bacteria and other organic contaminants. But when it comes to the fluoride, now that the water quantity is less, the fluoride becomes even more concentrated. So it does not solve that issue.
Right.
Yes.
Some interesting tips. We're running out of time. I'd love to continue this conversation, but definitely it continues, to our digital platforms. So even as we're going to be wrapping it up, you'll also be sharing, your socials, so that in case they have all those questions, they throw it for you.
Yeah.
But then tell us, what kind of advice would you give, to the people who are in these areas and people who don't really have much knowledge on this, as your parting shot?
Right. So thank you very much. And I'm really happy that we're having this discussion, because this is a starting point, creating awareness. Second, people really need to take care of the water that they're taking. This goes to the developers. Even as you are giving us borehole, please make sure that the water has adequate, has enough the recommended fluoride level. Then also, because interestingly, this is a disease that affects the haves. These are people that are able to dig boreholes, because you find in the slums and other places, they usually wait for kanjo water the day that it comes with the mitungi. But the rest of us in these apartments, we supplement with borehole water. So if you can be able to get a defluoridation machine, and a lot of research has gone into it, there is a group of my colleagues that have a very nice defluoridation machine. It's called Platinum Vesa. They can be able to install that, and you can be able to regulate the kind of water that you're taking in your houses. But also, as we move forward, if people are affected, because we said it affects even the psychology, and especially for the kids, then they should visit the dentist. It is very, very important. Avoid those going to quacks, because then they'll create a bigger problem than what you already have.
So umesema hii lazima iwak.
Lazima iwak.
As your boss definitely says, you can see the whole lapel pin on it. Salimia to Nairobi government.
Nitume salamu kwa.
Oh yes.
Of course, my bosses, I have 3 bosses.
Okay.
One is called Dr. Irene Mushoki. She's the Chief Officer of Medical Services. Then we have Dr. Ton Nyakaba. He's in charge of public health. And we also have Geoffrey Mosiria, who's in charge of health facilities. And of course, all my colleagues, directors and fellow doctors, and of course the boss himself, Governor Sakaja. Thank you.
Okay, Salimia Sak sana Kabisa. Asante sana Dr. Peter Jackson Mujuki, a dental surgeon. Tumeshukuru sana. We've got quite a lot of tips. I've learned some new stuff today. I hope back at home you've learned also some new tips on how the whole dentition, when it comes to all that. Koko hizi areas unaonanga hii matters discoloration, unashanga, hey, what's the problem? How can all this be going around and everything? In case you're actually joining us right now, don't worry. Go to our YouTube page, TV47.